Good evening. The news gang is here, and tonight, rallies of death, the politicians, the pandemic, and an angry minister. Are we courting a lockdown? Also on the show, a huge mountain to climb, the noisy road to the house of Mumbi. Who will get the bride? Plus, bottom up, bottom down, trickle down, and all the other ups and downs, the anatomy of an economic contest. Has anything changed? The memo is a red alert on the Delta variant and the new spike. On the punchline, the folly of sitting on the fence. The kicker returns to the graveyard of dead promises from elections past. While on the angle tonight, can you see what I see with the CBC sea change? You'll see what I mean.
Sasa mambo imeanza kutoka hapa Gatanga kwa SK. Mwenendo mpya. Juzi nilisema kuna kitu kingine kitatokea, wengine walikuwa haamini. Lakini ninatoka hapa. Mwenendo mpya ya kuunganisha Kenya kwa sababu ya ile handshake inatoka hapa.
Na kuomba tembea Central. Uliona wakati ulikuja Nyeri, tulikukaribisha. Hapa Murang'a umekaribishwa vizuri. Tunataka utembee pembe zote za hapa Central.
What is dirty is our politics. And if we can clean our politics, I can tell you the program and the project on which Rais Uhuru Kenyatta and Raila Amolo Odinga are on is the way to prosperity and a greater Kenya, for not only for us, but for a future generation.
What we can do to enable that money go to the grassroots ni ku increase ile pesa ya devolution. Ili pesa iende mashinani.
Bwana Peter Kelly, nataka nikuhakikishie tutakuwa pamoja. Na tutakuwa pamoja kwa Raila Amolo Odinga.
Sisi tutaangalia ile upande ambayo tutakuwa inaangalia watu wa Mlima Kenya, na sisi tunajua vile ambao tutapewa direction na president, vile amesimama katika upande wa handshake. Tunajua yeye anajua kile sisi ambayo hatujui.
All right, so those are sights and sounds, as we would call them, from Ndakaini just about 2 days ago. And we'll come back to that conversation in just a short while. Ladies and gentlemen, Yvonne Okwara Matole is away tonight. We hope to have her back. But Njoki Shege is with us, sign language interpreter. But ladies and gentlemen, I should say, we cannot start this conversation without talking about COVID. The numbers are not looking good today. Positivity rate at 14%. I think it's been twice at that number this week. And just yesterday, it was 18%. Jamila, you've been tracking these numbers. This is getting to extremely worrying levels.
It's true, Joe. And I think even the ministry is baffled when the minister was speaking yesterday, because the numbers have been sort of almost standard in the past couple of months, not in the double digits, of course, 5%, 6%, 7%. But I think for the past 2 weeks or so, the numbers have been going into double digits. As you said, today we're at 14%. Yesterday we're at 18%. The day before we're at 14.2%. The day before that 13%. 12, 13 again. So these numbers are the double digits and they're staying there. And one of the things that is concerning or worrying about these numbers is that Nairobi seems to be having the bulk of the infections, and it's just not kidogo, Joe. For instance, today out of the 1,068 people who were infected, 489 were from Nairobi. That's almost half. Yesterday, about 391 out of 1,000. The day before that, out of 976, over 400 were from Nairobi.
Yeah, the average they're talking about is 35%.
Yes, 35 or even higher. And because of the fact that now we've been told, and I was listening to Dr. Lois Ombajo speaking earlier, saying that yes, the Delta variant could be what is going around the country because it had been confirmed in the 13 counties that had been locked down. And we've heard about the severity of the Delta variant in terms of even those who've been vaccinated ending up in hospital. And of course, we're told that even if you've been fully vaccinated, it doesn't mean that you will not get COVID-19. It's just that inapunguza makali yake. You may not end up in hospital under oxygen if you've gotten both jabs. But as a country, we know so far we have slightly over 1 million people who've been vaccinated fully, and we're still expecting more vaccines as they keep coming in. But what is worrying also about this trend is what the minister said yesterday, blaming politicians for what we are witnessing. Because the past 3 weeks where we've been seeing these double digits have also coincided with very many political meetings. And that is a huge concern in terms of how these numbers are, this virus is spreading. But then now, Joe, if you look at the situation across the continent in Africa, the numbers are higher. The report by the Africa CDC has shown that the numbers are going higher this week as compared to the week before in terms of infections. And you look at the whole African continent, about only 1.3% of the people in Africa have been vaccinated. We are talking about this whole issue about vaccine apartheid and the fact that richer countries have more vaccines than they need, and we are struggling to even vaccine the few people that we have. So why am I going with all this? I'm trying to tell Kenyans that the virus is still here, and we need to be careful in terms of getting infected. Consider the fact that already we are hearing there are issues with not having enough oxygen in the hospitals. We're starting to hear hospitals major. And who will end up suffering? It's you who has gone to a political rally. It's you who's not wearing a mask. It's you who's not practicing social distancing. So I think it's about time we need to remember that this vaccine is there, this virus is there, and we need to be as vigilant as we were when we first heard about COVID in Kenya about 500 days ago. Joe.
And Dilas, with all these alarm bells ringing everywhere, it's still shocking if you just move around, whether it is watching those rallies, or I mean generally just looking at how things are, how Kenyans are, and you try and compare that with how we were when this thing first came on our shores, it's like day and night.
Day and night indeed, Joe. And if there is one thing that doesn't work about COVID, it is our attitude as a people, as Kenyans. When you go to any public place right now, and you will see whether it's markets or streets, people are actually forgetting now to wear masks. You go to places where there are all these clear signs, please maintain a distance of 1.5 meters. But we always think it's about someone else. I think it's encouraging that the vaccination program may actually record make some greater strides, have more people vaccinated, because for us, we struggle a lot with the protocols. And that's because it's a Kenyan thing. Because COVID works like common cold. If it worked like Ebola, Kenyans don't do blood. So that would have scared us. But if it works like a common cold, then we'll assume it's a common cold until it's not.
Wow. Francis, enforcement, some people say that that too isn't working anymore.
It's an animal farm kind of enforcement. Why do I say so? Because you'll still see people, ordinary citizens, who are being arrested here and there for failure to wear their face masks, enforcement of the curfew regulations, and so on and so forth, which is a good thing. Enforcement is good, but enforcement must be uniform, must be across board. It must not favor some and disadvantage some. You saw the other day about 15 MCAs or leaders from, I think it was Trans Nzoia County, yes, who were arrested and taken to court and fined 15,000 shillings. But maybe the implementers should have gone a step further and mopped all the major politicians who have been holding political rallies and so on and so forth. And unfortunately, it starts from the very top. And as long as there is no proper enforcement, as long as there is defiance of these guidelines, we will continue to have this problem. And if you look at the last 1 month or so, you're talking about huge numbers, and there's a correlation between increased political activity and the rise in numbers. But what is important to look at is the state of our health facilities. We are still not yet there. Our health facilities are still struggling. And when you talk about lack of oxygen, and the numbers today are telling us that there are 3,918 patients on home-based care. 176 are in ICU. Out of them, 43 are on ventilatory support, 82 on supplemental oxygen. The situation is getting worse by the day.
Yeah, and I think that something that Jamila mentioned, which is kind of the thing I would emphasize, is that what experts are saying is that the vaccine does not quite stop you from getting COVID-19. I mean, the studies around that, as Dr. Mbajo was saying, are still scanty. No one can really say that. But for certain, they know that it can reduce, the severity of the disease, your chances of getting to hospital, being hospitalized, the chances of dying, and that sort of thing. But even that still has a big but, because there is also the question of people have different things they call comorbidities. This whole, you have underlying conditions that make you more vulnerable. So even when you're vaccinated, that level of vigilance still has to continue. And given that the Delta variant seems to be spreading, not only spreading faster, but it also is more serious in terms of the symptoms that people have, means that the level of vigilance cannot go down. And for me, just one final thing, a silver lining in the region, seeing President Suluhu Hassan yesterday taking the jab and the country receiving 1 million doses, I think, of Johnson & Johnson vaccine, and basically going on this aggressive campaign to get more vaccines for Tanzanians. I think that's not just something happening across the border, but something that is of interest to us, given how interconnected our peoples are. If you think about the number of things that happen between the two countries, the number of business people who cross back and forth, I think that that's a breath of fresh air, considering the kind of sentiments that used to come from that country before, with particular regard to COVID-19.
It is a seismic shift.
I think it
yeah, absolutely.
But we need to remember we still have Burundi and Eritrea, which haven't started.
They're not far
vaccination
from us.
rollout.
Like,
yes.
essentially, nobody knows what on earth goes on in those countries. That's really sad, and I just hope that something changes in those two countries.
I hope so. And it is also important to note that tomorrow the National Emergency Response Committee is meeting.
Yes.
And the people in 13 counties that were declared COVID hotspots are still waiting for some reprieve of sorts, bearing in mind that the timelines and the curfew regulations were to lapse on 31st of August. Let's see whether there will be an extension or maybe a slowdown in terms of the implementation, because there's still that struggle of lives and livelihoods.
Yeah, I mean, I was speaking to someone from there not too long ago, and one of the issues they really have is a 7 p.m. curfew. Yeah. So anyway, you can have your own random thoughts about what will happen there.